Understanding and healing diastasis recti. Have you ever felt no matter how many crunches or planks that you do, yet your belly still sticks out a little bit after having your baby? Do you feel weak and don't trust your core? Do you also maybe have some leaking, or just in general, don't really like how your body looks after having your baby? Don't worry, it's not your fault. It could be diastasis recti, and I'm here to tell you that it can be treated. Hi, I'm Justine Calderwood, owner here at the Healing Spot Physical Therapy. I'm a certified birth healing practitioner, certified pregnancy and postpartum athleticism coach, and the leader here of our therapy team at the Healing Spot. I want to talk to you in this video today. We're going to break down diastasis recti, and in particular, I'm going to talk to you about what diastasis recti is, why you are experiencing the symptoms that you are, and also I want to talk to you about the unique three-step process that we use here at the Healing Spot in order to treat and fix diastasis recti. So let's dive into exactly what is diastasis recti. I'm going to show you an illustration here in a little bit, but I want to start by saying that diastasis recti is very common after pregnancy. So if you are postpartum, you've had one or more babies, and you think you have a diastasis, I'm going to show you exactly what that looks like. And I also want to say that, preventing diastasis during pregnancy is not really something that we do, because I want to say that 100% of the time, women that are pregnant are going to have diastasis recti. It just depends on how bad it is, but it's not something that we really say try to prevent. So let's talk a little bit about that. I just want to take a moment, though, to say that some other causes of diastasis recti can be chronic, like increase of pressure into the core and mismanagement of pressure. So that could be from chronic coughing, it can be from chronically bloated, or even lifting improperly. That's not quite as common, I will be honest. So let's take a look at this illustration here. And this shows you really what diastasis recti is. We think of it as a separation of the abdominal muscles. So we have two sets of abdominal muscles here called our rectus abdominis, okay? And they allow us to bring our trunk forward like this, okay? They're kind of like if you were doing a crunch or a sit-up. Well, there's a connective tissue line in between called the linea alba, and it helps to keep those muscles together. Well, during pregnancy, for instance, when we have all of that stretching out as baby grows, what happens is it puts a lot of strain onto that connective tissue that keeps the abdominal muscles together, and it starts to separate. So you can see there's different ways that this can show up in women. This would be here is just a normal abdomen without diastasis, okay? And you can kind of see the six-pack abs there. This is what I see most common, where we have a diastasis right at the belly button. And if you think about that, that makes sense, because that's going to be the point of most strain during pregnancy. You can have a diastasis a little more prominent below the belly button or above, or it can be pretty even kind of as it goes down. So I will say a lot of times when you get information on the internet, all they're emphasizing is the gap and how wide it is. And while that's something that we look at, it's not the only thing. I'm going to dive into that a little bit more as we talk later in this video. So what are some symptoms that you might be experiencing if you have diastasis recti? One is you might be able to see or even feel that separation into your abdominal wall. Another thing that you might notice is just some, like what they call a mom pooch. So just some pooching out, or even coning or doming when you're moving. Say when you're getting out of bed and you just sit right back up to get out of bed, or you might notice it with exercise. Some other symptoms might be weakness in your core. I wanted to take a moment to talk about that, because really a lot of people, when they hear the word core, they think it's just their abdominal wall. And I want to show you this illustration where you can see this is somebody looking this direction. You can see their spine here. This is the abdominal wall. Now, your deep core muscles include the abdomen, but it also includes the diaphragm along the top and the pelvic floor muscles underneath, and back muscles that go in between the vertebra. So all of these muscles, if we think about the core really being all the way around, kind of like a canister, we don't want to just focus just on the front. However, that's what a lot of times people know that it's kind of coming from there, because they have the separation that's causing kind of a strain and not allowing that whole core to feel like it's nice and strong and able to function the way that it needs to. So it can cause some like instability, or like almost like you don't trust your core, like you can't lift and move and carry things like you used to. It might even lead to some back pain into the backside, pelvic pain, again, because of the connection in with the pelvic floor muscles, and also just feeling like something just feels off. It can also cause things like hip instability, again, almost like you don't trust your body to do the things that you normally would have relied on your body for: pushing, pulling, carrying, and lifting. Here at the Healing Spot, we work with a lot of pregnant and postpartum moms. And what we hear a lot from the women that we work with when it comes to diastasis are things like, I just don't like the way my body looks anymore. They're very self-conscious about what a diastasis looks like. Kind of some of that pooching, they don't have the tone that they used to. Again, it kind of comes back to the core not moving and being as strong as it used to be. Some other things that we hear are just, I'm scared. I don't know what I can do as far as exercise or movement. I don't want to make it worse. So there can be a lot of fear in movement when it comes to diastasis. There can also be some frustration or overwhelm, particularly if you are one of those people that are kind of searching for information on the internet, or you're seeing things on social media. Again, there can be this hyper focus on how wide the gap is. And so women are kind of checking that at home, and they're checking just the gap. They're not really told that there's other parts of it, like I said, that we look at as therapists in order to determine the full health. So there's other ways that we look at diastasis recti as we're assessing it. Beyond just the gap, we're looking at how long it is, but also what is the coordination of the core? Is there a good breath pattern? What's the posture of this person like? Because all of that can contribute to whether you have a very severe diastasis and that you have quite a bit of work ahead of you to fix it, or whether, yeah, maybe you do have a wider gap, but everything else looks good and you have a short road to recovery. So there can be a lot of information out there, some of it good, some of it bad, some of it kind of conflicting. So I get it that sometimes you might feel frustrated or overwhelmed. Here at the Healing Spot, we see a lot of women with diastasis recti, and we help them to feel confident again. And we help them to learn to trust their body. We help them to feel toned, and also help with the body image part of this as well. So I'm going to talk to you about our unique 3-step process here at the Healing Spot that we use. Number 1 is we're going to listen to your story and find out more about how this is impacting your life. So we ask a lot of questions about, tell me more about how life looks now versus what you want it to look like. Okay, what's holding you back? How are you feeling about your body? In what way is diastasis recti impacting your life? Because while one person might be focused on the exercise or movement aspect of how it's holding her back from hiking or going to the gym and feeling confident, another woman may have, her main concern may be related to her body image of, I can't wear the clothing that I want to. I hide behind baggy clothes. I don't feel comfortable in a swimsuit. I don't like going on vacation anymore because I don't like the way my body looks. Where somebody else might focus on other aspects. There might be some overlap. So we want to listen to your story. We want to know more about really how this is impacting you so that we can already start to understand what's motivating you, but also how can we help? Step number 2 is finding out how bad things are. So the way we do that is really by doing a formal assessment. This is where we get the baseline information that we know as therapists. What are we looking for? We're going to look at things like your posture, how you're moving. We're going to look at strength. We're going to look at even tension or strain patterns in your body. One analogy I want to tell you really quick, I love using this, is when we think about diastasis recti and we have that linea alba in the middle that's keeping the abdominal muscles together. What I tell women is, imagine that as you have baby growing, that it's kind of like a jacket that gets a little snug, okay? So if you have that zipper in the front and you have baby that's getting bigger and bigger, what that's going to do over time is put some strain on the zipper. And that can happen from, just even baby being in the front, but also think during pregnancy how tight you get into the back. not being able to rotate in that. So if we have some tightness in the backside here as well, it's going to put some strain into the front side. So we look at things like that, not just at the abdominal wall, but the whole core and you as a whole person. So we really find the baseline information to find out, okay, well, how bad is this? And then that allows us to then move to step 3, which is fixing the problem and making sure it doesn't come back for you. So step 3 really is fixing the problem and helping you to reach whatever goal it is that you want to reach. Again, we got to go back to your story and how this is impacting you. So there's going to be a unique goal that every one of our patients come in with. So think about right now, if you've gotten this far in the video, how this is impacting your life. What would life look like if you could solve this? If we could help you solve this, would you be more active? Would you feel better about yourself? Would you have less pain in your back or your pelvic floor or your body in general? If so, I want to tell you a little bit more about what we actually do to solve this. We really look at our patients holistically. So what that means is we're not just going to look at your, how that separation is or how wide the gap is, because that would be looking at you like through a very tiny lens. We're going to soften our view, meaning we're going to look at you as a whole person. We're going to look at your posture, how you're breathing, because we know, again, the core includes the diaphragm in the rib cage up here. We're going to look at your strength. We're going to look at your flexibility. We're also going to take into consideration, again, how this is impacting you. So our treatment is really going to dial in on whatever, say, problem areas or deficit areas your body is showing us with those tests and measures that we do. So again, it might be focused in on learning how to rebreathe. It might focus in on sometimes doing manual physical therapy where the therapist actually uses their hands. Let's go back to that jacket analogy. Maybe you need some nice work into your back or your side, into the oblique muscles. Maybe some of the work needs to happen right along that linea alba and into the front. It might be exercise. So that could be in the form of strengthening, okay, which that makes sense, right? But it also might be in the form of stretching so that we get a better alignment here between the pelvis and the rib cage, and we don't have as much strain here into this area. It could include things like our Fit to Be classes. These are online classes that we use specifically for our clientele because we know that's a great way to kind of knit together, bring together those muscles to allow better coordination, better strength, and better function of the core so that you can do the things that you want to do, like lifting weights, like picking up your baby, like going for a hike, whatever your life looks like on the other side of diastasis recti. It can also look like a exercise screen. So we have a return to run or return to exercise screen that we love to do with our patients. Again, it helps us to identify where those problem areas are so we can really focus in on them so that you can get back to things like running, lifting weights, jumping and doing burpees or jumping rope. Again, just being as active as you really want to be. Another option in your customized treatment plan may include our shockwave therapy. This uses ultrasound waves to help regenerate tissue. So when it comes to something like the linea alba and this connective tissue that's been separated, the shockwave machine can really boost healing, and we're finding really good results using it with our postpartum moms. You don't have to accept the symptoms that you're experiencing right now. There is help that's available. We would be honored and happy to guide you back to feeling strong again, feeling confident in your body, getting rid of any pain that you're having related to diastasis. The next step that you can do is just use the link below here in order to get some more information from us. Reach out to our team and book a discovery session with a member of our therapy team so that you can sit down with us either in person or even virtually in order to get all of your questions answered. Find out if our approach here at the Healing Spot is going to be a solution that could work for you. We'd be happy to help, and I look forward to speaking with you soon.